name is David Ollila, and I am a surgical oncologist here at the University of North Carolina. I have been here 22 and a half years. I'm in my 23rd year here at UNC. So I am a fellowship-trained surgical oncologist. I'm broadly trained in all of the cancers of the surgical oncologist. As we've gotten bigger at the University of North Carolina, we've all started to niche. So we have program focuses, we have lead people in a tumor, we have support people in a tumor. So I have niched down to melanoma and complex skin cancer, where I'm the program lead, and then my second tumor is breast cancer. Surgery seemed to be a sweet spot for me because it was, the intellect was matched with doing something with my hands. So that really wasn't the hard question for me. The harder question for me was defining myself in which surgical subspecialty. And I chose surgical oncology because I was really attracted to the idea that you had a team approach, right? And we know that team approach is talked about a lot. Well, cancer has been doing that for 25 years. And maybe even longer, you could argue. There has been this whole idea of collaborating with the radiation oncologist, the medical oncologist, the geneticists, the physical therapists, right? That team approach to taking care of cancer patients has been going on. And so when I was going through the end of my residency, deciding on fellowship, that's what ultimately attracted me to doing a surgical oncology fellowship, is the team approach. This is a one-on-one, engage with the patient first, then go to the family member, right? So there's a lot of times where the family member wants to jump in, and I redirect it that this is the patient first. We'll get on the phone, we'll talk to anybody, I'll talk to the family member that's actually in the room, but this is about the patient first. I would want a new cancer patient to know, especially if they have the diagnosis of the most lethal skin cancer we know, melanoma, that we have such a broad team in place, from surgical oncologists to medical oncologists to dermatopathologists to dermatologists to advanced practice providers to PharmDs to nurse navigators. We have it here for you. So whatever your issue may be around your melanoma, we have that piece in place for you. You don't need to go anywhere else to get those. We have clinical trial access. We have the expertise in-house to handle every and all melanoma patient.